Hey there, it's Esther Goldstein, and I am so excited to be saying hello to you. My heart feels so full getting connected to therapists, psychologists, social workers, art therapists who are devoted to deepening their knowledge about trauma therapy, trauma-informed care, and somatic methods. Why? Because I have seen the difference that being trauma informed makes. I have seen as a client, felt, I should say, and seen as a professional, the difference that therapists who use generic therapy or even some intro methods to trauma work, um, and the difference between those who are like really skilled and really confident and really equipped to deal with clients with a bit more complexity. So I just want to say thank you for being here. Somebody just asked me the other day, what's my why, right? Like, why am I a trauma therapist? And more than that, like, why do I train therapists, right? I'm not just a therapist and a trauma therapist. I own and run a group practice. I also run this trauma training. I'm finishing my book now. It's actually finished. I just have to submit it. Um, a book on treating anxiety and trauma with EMDR and somatic work and parts work. And I'm so passionate about it because I see how trauma and pain and struggle and neglect um, pulls people away from being connected from themselves, from others, and from the world, and how healing is actually about reconnection. We help our clients reconnect to themselves, reconnect to each other, and reconnect to the world. And when I mean the world is so many times when we go through a painful experience and the pain feels so great and then the disconnection feels so great, then we can walk around the world feeling really misunderstood or like on defense or shut down. So that's my little passion point. A little bit about me. I am a mom. I love pumpkin spice coffee, just saying. I'm from New York. That's why I sound like coffee. There's pumpkin spice, there's pumpkin flavor coffee in here and pumpkin spice creamer, just saying. And I love making pumpkin muffins. Okay, so what we're gonna do for today is that I'm going to show you what you get um, when you sign up for the trauma training. I'm going to show you a little bit about my practice, actually, the group practice that I run, tell you a little bit about my training so you know who I am and that I know what I'm talking about. I think I do. But I will say that even though I have wisdom, I'm always learning more. Every single one of my clients teaches me something new that I haven't yet learned. And it could be a new struggle or a different kind of protective mechanism they might have, or my own consultants and ongoing training teach me a lot. So I do have a lot of knowledge that I'm going to teach you as much as I can in this training and consultation. And also, like, I'm just right alongside you learning the things that you're learning as well, maybe um, deepening it a little more. And I've connected to experts and I keep connecting to really wise people who are humble and kind and learning from their expertise. Okay, so let me just show you. First, I'm going to show you about our group practice. Okay, so I just want to show you like the practice that I work at, and so you get a little bit of a sense of who I am and what I'm up to in my regular day. Um, Besides for engaging and being a mom and my daily prayer. And I love hot yoga and boxing. I love the work. And I want you to love your work too. I want you to feel proud of the work that you do. So here's our group practice. We have a location in New York and Long Island. We have offices. We specifically work with anxiety and trauma, but we also work with clients with attachment, struggles. Um, What I've done is I've created over the years like a team of therapists where it's not just therapists that are, you know, therapists, but are like trauma informed. Okay. So over the years, we've created not just um, therapists who help clients, but also therapists who support each other, which is part of why I've created this trauma cohort. Is what I've seen the need for connection and community is really big. I know for myself, when I started being in the field, I would go literally like a few times a week to peer groups, to consultation groups, to trainings. Like I felt so isolated. And I was juggling a lot. And so then I'm like, I want to create a place where we're not just asking therapists to show up for their clients, but also let's provide community for therapists to show up for each other. Um, and so over time, I would run a lot of groups for peers. And then I went to my own groups that I would obviously pay for consultation. But then I created a group at my practice where on Monday meetings, we have 2-hour meetings. We start with the meditation. We talk about a strength, a struggle, and a need, and then we go into clinical consult. And there's like a shared humanity. I've taken my team on staff retreat, and we've gone out for celebrations, and so the cohort is like a replica of that, right? Really providing that sense of community and support to therapists wherever they are. We have people from Portugal, Iceland, Germany, um, England, Canada, anywhere. Okay, this is briefly just my office, a tour of my office space in New York. And then I'll show you our town. If you're ever in New York, Island. So I'm showing this to you not necessarily because, please come visit my office, but I also want you to get a sense of the place that you're working at or the place that you want to create for your clients, right? I'm showing you, I actually designed those rooms. But like the feel of the energy of a physical place that you welcome your client into really matters. Then we're going to talk about the clinical sense. Then we're going to talk about the structures. Then we'll talk about treatment. But I want you to think about, just like from the very first conversation you have with clients, it really matters, right? How they feel, a developing relationship of trust, of clarity, of transparency. The physical space also really matters. Um, so a little bit about me, right? I'm a social worker and trauma specialist, founded this treatment center. And here's some of my training. I'm an EMDR therapist, I'm MGS certified and a consultant. I did a training at Hebrew University for treating trauma. I did 1 year at the Institute for Contemporary Psychotherapy, intensive and DBT training, attachment focused EMDR with Laurel Parnell. I've done all 3 levels of somatic intervention. And then I'm trained in sensory motor psychotherapy. I've done all 3 years. And then IFS. I did 2 years, 2 levels of IFS training. Now, if you're on here, what you've likely seen is this other site that I have that's specific for therapists, okay? So many clients will reach out and they say, hey, like I want my therapist to be more trained, or I need therapists. I need a therapist to go to. And if I'm full or my clinicians are full, I'm always looking for therapists to refer to. So what I've done is I created this program, right? Training, consultation, and courses. And so I want you to claim your passion for working with trauma, okay? To really embody the wisdom and the skills. What I've done is I've gone ahead and I created a training course. And this is likely what you've seen, okay? If you're on this or if you're thinking about joining my course, my training. We have an integrative trauma therapist certificate program. It's a 6-month program. And we teach you how to really deepen the skills you already have and even expand on them. Okay. The training is, it's approved for CEUs and you get a certificate of completion. You get 30 CEUs. And the way that it works is it's 6 months. So it runs from January to June and June to January. I run this twice a year. I keep the groups really small because I want to get to know each of you. I want to get support each of you and really get to nurture your skills, your strengths, your struggles, understand what clinical dynamics are going on in your office or in your workplace, and really help you feel like you're walking away with a level of expertise and clinical nuance that you didn't have before. Okay. So it's a 6-month training. What we have on a weekly basis is, I'll go through it while I go through the page. What we have is that we have, it's a back, I'll show you the back end. So every week you get a drip content of information. There is video information. There's written information. You read some information, like there's trauma resource library. And then there's every other week, there's a live call for 90 minutes. Okay. So say we start, and it's every Tuesday. So every other Tuesday from 12 to 1:30 p.m. Eastern time, so around lunchtime, we have this live call on Zoom. Okay. And that's the call where we share about the clinical consultation. That's where there's a sense of community. We have 10 people in a group, so we keep it really small. You get to know each other. I run it similar to how I run my team meetings, in the sense we start with the meditation. Every time it's a little bit of a different meditation. And then we check inside with each person if there's something, a question they have, a clinical question, or if they submitted a case consultation question, and what they want to walk away with that week from the cohort. So you really walk away with something tangible for yourself, okay? And you develop a great connection with people who are also growing alongside you. This experience, I have to say, is similar to my trainings. I've done trainings and I thought I was doing them for my clients, which of course you're going to get something out of this for your clients, but really it's going to transform you. The trainings that I've gone to that really helped me were ones that I practiced the skills, I learned it, I tried it on, I personalized it to me. I came into the next sessions with the clients I saw with a sense of confidence and ease. And that's what I want for you, okay? Like you have ownership of the material. So this trauma therapist certification is here, that it's a mix of a few of the methods that I've gotten. So I got trained in Somatic. I pull a lot of skills that I found really useful over the many years of training, and more than that, consultation. I've reached out to expert consultation and attended a lot of individual consultation, and still do, to learn how do I, okay, so I learned this concept, how do I apply it? Does this client need an intervention like this? Do they need behavioral? Do they need somatic? How do I structure? So I over here created, in a sea of trainings, I blended EMDR. If you're EMDR trained, great. If you're not EMDR trained, you're fine. You're still welcome. It's not an EMDR training, but I am an EMDR consultant. So I might teach you a concept and say, if you're EMDR trained, you can add BLS, which is bilateral stimulation. Somatic tools, people who taken this course love the somatic tools, honestly, the most. And IFS, internal family systems parts work. So we teach you a lot of really integrative, that's why I call it integrative trauma training. And the goal is for you to feel more confident, so that when you have a client who comes in your door, you're confident that you can help them, and they feel secure from the nonverbal cues from you that you know how to help them. Okay, let me just show you. Okay, so here's the certificate of completion that you get when you finish. It's approved by the Board of Education, right? Integrative trauma training. You're going to learn how to confidently utilize assessments and interventions to skillfully navigate the nuances of providing trauma treatment. You'll show up with patience and flexibility, be more skilled in attaining good treatment goals, develop multiple ways to improve your clinical outcomes. You'll know how to better diagnose and provide treatment. And then here are each of the modules that you are going to learn. Module 1, making of a trauma therapist. Trauma is not for the faint heart. Commit to your why so you can have the focus and energy you need to show up day to day. The outcomes for Module 1 are get to the core thread of your client's pain point so you can provide relief. Clients sometimes are swirling in a circle, and what we want to do is help them get clear about what's really going on. What's their primary pain point? Someone could come in and complain about their mom, but really they feel misunderstood. Really they feel alone. Really they're feeling angry. Really they don't feel anything, and they're just out of touch with their body, right? So that's part of you getting in touch with what's their pain point, right? Set you and the clients up for success from the very first session. You set up a good treatment plan, good clarity for communication, good clear expectations on treatment plans. Identify how trauma shows up differently in each client. Now, some clients, we don't use the term trauma at all. We'll just say how their pain shows up differently. Right? For everyone, their pain, their struggle, their whatever it is shows up differently. We don't have to call it trauma, but we want to see how their pain or their struggle or whatever it is that they went through or didn't go through, if it's neglect, is impacting their life. We're always looking at improving their life functioning. It's less about diagnosis, I always say. It's much more about symptom reduction than diagnosis, okay? Now you want to manage the energy in the therapy room. When you're expending a lot of energy on either working too hard for your client or not being clear on your goal or bopping around from topic to topic, you're not managing your energy well. And I want to help you manage your energy well so you could be in this field for a long time and not burn out. And then you identify your why. What makes you passionate about this work? I want you to feel so checked in and energized by this work with getting clearer, knowing why you're in this field. Usually we're in this field because either we were caretakers or we had to caretake for ourselves. And so we're so good at it. But to really be in this field in a way that we take care of ourselves, feel fulfilled, and take care of others, we want to really solidify that why. Module 2 is have clear treatment focus and skills to provide relief. You want to get clear from the very beginning, right? So you want to have a clear treatment focus. And you want to provide relief. Now, relief for some clients is even just helping them understand where their struggle is coming from, why they're struggling. For some, it's diving in and already providing an intervention, right? Or giving them a level of awareness or engaging in a behavioral or a cognitive approach, right? So that's part of like knowing where to go in and when and how. Outcomes of module is structured treatment to help the client experience immediate relief. Identify which trauma diagnosis your client has. Instill hope by providing psychoeducation and a roadmap for personal healing, and get the scientific research on the three different kinds of trauma diagnosis. Okay, when you're more confident and clear about what the symptoms are or the diagnostic criteria your client has, they will feel clearer and more confident because you know where you're guiding them. Module 3, it's never if you hit roadblocks, it's when you hit roadblocks. I had a client once who said, like, I'm such a difficult client, I'm never going to get better, because she would often have like dissociation or parts of her that were protective or doubtful of if she wants to even get better. And I was like, hello, this is your therapy work, especially when it comes to trauma or neglect or whatever, right? Like, it's not if we hit a roadblock, oh my goodness, what are we going to do? That client's complicated. No, they're not. Roadblocks are part of therapy. And so it's a matter of us being confident and expecting those roadblocks and knowing how to move through them, right? It's kind of like hitting blockages or hitting stuck points. So working with clients who have a very protective system, or they're shut down, or they're not aware of themselves. We don't judge them or say they're difficult. We work with that. That's part of the treatment. And if you can work on that, you're going to start seeing shifts in their life, because usually they have that defensiveness, protectiveness, shutdownness, polarity of one part that wants one thing and one part that wants another. One part wants to improve the marriage, another part is afraid of investing because they've been so let down, right? So, and then I want you to confidently plan for navigating complexities that come up in treatment. The outcomes are you're going to recognize when dissociation enters the room. That's one of the complexities. Interrupt toxic shame cycles. I have a whole segment on healthy shame and toxic shame. We want to interrupt when the toxic shame comes in, okay? Move from complicated grief to processing grief. Grief is a sad emotion. It's a big emotion. But there's clients who we can help them process through their grief and they actually feel better. And there's clients who get stuck in it. So we want to move to the processing through them. Then we practice relational interventions for clients with attachment wounds. I have so many creative, somatic, and attachment-informed interventions where you help clients who are stuck in either very avoidant or very anxious, or really working with our attachment dynamic. And confidently challenge blockages and defenses that come up in therapy. Module 4 is complicated trauma, emotional neglect, betrayal, abandonment, and rejection. This is huge for the clients who are struggling in relationships, either in unfulfilling ones or can't get into healthy ones, difficulty setting boundaries. Module 4, understanding trauma reactions and survival strategies and how they show up in our clients' lives. So here, you teach your clients how to link trauma to their coping mechanisms, right? What was their trauma? What was their struggle? What was their wounding and how it's connected to the way that they're coping in a healthy way or maybe in a less than healthy way. You want to identify implicit and explicit triggers, the things that they are conscious of and unconscious of, right? Because when you bring the unconscious to conscious, then they have the ability to have choice and there's much more options, right? Develop your sixth sense as a therapist. Here's when clients say to me, they ask me why I'm trained or why certain therapists are so good. It's almost always because that therapist has cultivated a sixth sense. And I want you to have that. Your clients could sniff it. They might not know what it is, but they can feel it. Be an expert in neurotransmission, neuroplasticity, and somatic memory to educate your clients. So there's a lot of images and science and research on neurotransmission, right? We're not just talking about heebie-jeebie fluff. We're showing you images of the brains, the neurons in the brain. Somatic memory, cellular memory, why they have body flashbacks, why they have big waves of emotion. Tools, I teach you a lot of tools to regulate the limbic system, the nervous system, your client's nervous system, because they have to be in their window of tolerance, not too out of it, anxious, or not too out of it down here and depressed, because then they're not going to actually feel better. And then we want to remove pathology from cognitive, behavioral, emotional, and existential coping responses. So we want to take away any judgment and pathology, okay? Know when you are colluding or colliding with your clients and recommit to the treatment structure. So colluding is when you're almost like disagreeing, when you're getting blended. They're hopeless, you're also starting to feel hopeless. You're almost like joining them in how they're feeling. And colliding is when you're almost in this like power struggle. I want to work on this, they want to work on this. And so these happen, okay? It's just a matter of noticing when they happen, being able to work with it, name it, and work past it and through it. Module 5 is assessments. I'm more than handing out a questionnaire to your clients. In this module, I give you the nuances you need to assess your clients' struggles properly, right? So we have written assessments, verbal assessments, there's a lot of research assessments. Become an expert diagnostician, identifying pressing concerns, right, for your client. So you're really listening to what their worries are. Assess clients' needs to improve their level of functioning, right? What's the short-term relief they want and what's the longer-term relief they need? What do you focus on first and how do you respond to both of them? Assess clients' readiness and capacity to engage in deeper trauma processing, right? That's on you to be able to assess if this person is ready for deeper stuff, deeper work. And then use instructions and best practices of over 20 assessments. So I gathered this over many years. I've gathered so many resources. You'll see there's research articles, there's assessments for mood, attachment, trauma, somatic, dissociation, OCD, and more. I teach you how to use the DES, which is like the assessment for dissociation, and the MID for dissociation. Determine which assessment should be administered via hard copy, verbally, or other creative methods. And that really depends on your client's presentation, right? How and what way you're going to do. You're going to administer it. Module 6 is continuing on boundaries. Bring your clients to the finish line. You want your clients to be successful, but what does success mean? We need to define what success means. One client could say, I want to have no anxiety. And another client could say, I just want to be able to have sex without having chronic flashbacks. And another person wants to be able to be present without feeling like they're just going to be an explosion storm, right? Or another person wants to get out of functional freeze. Okay, so there's so many different kinds of goals, and that's part of you being very clear on clients telling you a story. What are they really saying? What are they really struggling with, right? Are you able to connect with them? A lot of what I teach you as well is when a client comes in, there's different kinds of therapy sessions we have. There's either a boundary session, there could be an attachment session, there could be a shock trauma session if it was like a single incident trauma, or there's developmental trauma, right? Where there's like milestones or emotional needs that were unmet. Okay. And so part of your therapy and becoming really good as a therapist is, are we working primarily on the concept of boundaries, verbal boundaries, energetic boundaries? Do they know where they begin and somebody else starts? Codependency. Are we working on attachment? Are they very avoidant or anxious or in this chronic state of seeking for security because they never really had a secure attachment figure? They never really got to experience, like Bonnie Bainbridge Cohen talks about, the yield, which is like the baby in your utero who could just be like, I don't have a place to settle. So they're always in fight or flight, right? I help you look at, like, okay, is this attachment? How are we going to work with this? Is it a shock trauma? Are they coming in with really bad PTSD or flashbacks? And we have to start getting into like treating them for shock trauma, or is it developmental trauma? Ongoing neglect or being shamed or judged, or have a very strong inner critic, or have obsessive like OCD tendencies. So that really is you getting better at understanding their symptoms, and then we come up with a treatment plan and we share it with them. Here we also teach you how to skillfully navigate rupture and repair. It's not if it happens, it's when it happens. We all have ruptures with our clients. If you're having a real therapeutic relationship, it's how do you navigate the ruptures when you have a disagreement, when you figuratively step on their toes, and repair. Set, track, and reach clear treatment goals. Dr. Scott Miller has this whole research on therapists who are rock star therapists, are the ones who have clients who stay in therapy for the longest and leave when their treatment is accomplished, not prematurely. And a lot of it has to do with how clear you are with your treatment goals, if you have outcomes conversations, if you know how to ask for feedback. There's a whole segment I teach you on outcomes conversations and really being a therapist that has a good name. It's more than your training. It's also your confidence, your ability to engage in honest and real back and forth, develops really good secure attachment, and also honest conversation and being able to hear feedback. Use effective scripts to initiate meaningful feedback conversations. I give you some. Keep yourself in check. A lot of what we work on is the transference and countertransference. How is it showing up and how to work with it? In the cohort, what I love is that people are just so humble and real and honest and are open to learn from each other, open to share, right? We have the case consultations we submit, we review it together, we talk about how we're applying these concepts either in our own personal lives. Sometimes in case consult, we'll talk about a client and I'll say, hey, could we do a role play? Or can I work on your reaction of hopelessness? Or can I work on your, impatience or fear about not helping this client, right? So sometimes I'll work with the person in the cohort, you, or sometimes we'll work on the client, right? We'll role play as if you're a client, or we'll talk about it. But a lot of times there's transference and countertransference, and we work on that, and we learn so much about ourselves and each other. Avoid flooding or stagnation. Sometimes, like, you might be going like too quickly and you're flooding the client, or you might be stagnant and going too slow. So we help you with that and knowing how and when to refer out, right? So that's some of the things that I teach you. Now, what you get from joining the trauma cohort is live consultation, supervision in the comfort of your home. It's an interactive training and consultation. You get 6 months of 90 minutes bi-weekly face-to-face sessions. Just so you know, right, you get to present your cases and you get clinical input. There's a bonus one-on-one session with me that you get free of charge. And that's something you get. You can have it either in the beginning, middle, or end. You have an entire trauma resource library, so answer to all your hottest questions at your fingertips. I'll show you the instructional videos, tools, templates, downloads, and lots of exercises. And you can have access to this for a lifetime. You get access to it and you have it all the time. So when I upgrade, shift, you have access to all of this. So of course, people like reading through the information, watching the videos. Most of the time people will set a time on Tuesday because we meet every other Tuesday for an hour and a half. Most other people will set aside their Tuesday from 12 to 1:30 to watch the videos, to learn the reading material, to submit their case consult. And then they come for the live calls every other week. But even if you can't keep up, because I have a lot of information, you have a lot of time to go. Like you might say, hey, I wanted to watch that video on shame and toxic shame, or hey, I wanted to watch the video on fight or flight. How do I do that somatic exercise again where the client moves their feet? When they feel that feeling of being trapped, how do you set it up again so the client could engage? And then I'll tell you, or you can have access to it, you find it. And then access to me, you get laser focused support to break open your heart and unleash your skills. I'm like super passionate, not just about me making a difference, but like as a group practice owner, I've had clinicians who worked in my practice who eventually then went to open their own practices. I love how I've inspired them, and they found their own passion, their own unique secret sauce, their clinical nuance, and their zone of genius. And I love supporting you to find what's unique about you. How are you going to help your clients How are you going to make a difference in raising awareness in your family, in your community, and with your clients? Some people go on to create courses. Some people write a book. Some people are just deepening their own work, right? So wherever there's one person who doesn't want to do one-on-one work. She's a consultant for people and for institutions, but she wanted to be clinically confident. And others want to deepen their clinical work. And you also get community, which we know we all need a sense of community. Finding your people and healing the world together. Join an exclusive cohort of professionals committed to advancing their expertise. Honestly, I think that if you look at the testimonials or you ask anyone who's taken the cohort, they love the part of getting to know each other. There's a sense of community, connection, celebrating wins, supporting each other in our struggles. And like I said, the learning format, there's synchronous where you come together for the learning, the interactive part, show you. And then there's asynchronous learning on your own schedule, your own speed. Okay. Here are some of the testimonials. I'll link it up on the page. Amy Peters is physician's assistant. She did psychological counseling for people in Germany coming back from Afghanistan. Daphna spoke about how, she gained a lot of IFS skills and somatic approaches. Devorah Kadosh, right, worked with people who were struggling with bereavement, deeper understanding of trauma. Artun is in Iceland. She works with people struggling with addiction and wanted to understand addiction from a non-pathologizing lens and working with understanding why people numb and how to work with their core pain point. Tabby Westbrook owns a group practice, people struggling with trauma and domestic violence survivors. Her and her whole team took the training, right? She wrote, "She knows me for many years." It's not only essential for therapists to be trauma-informed, they also have to have a variety of tools. Let's see, I'll just show you some others. Eliza Katz is an EMDR therapist. She does intensives. Michali Friedman is a therapist. She owns a group practice for sex therapists and wanted to deepen their knowledge in trauma-informed care because a lot of clients who come in with sex therapy, for sex therapy, you might have trauma histories and they want to work with it from a trauma lens. Bruchi Moskowitz is a psychodrama therapist and wanted to deepen her knowledge as well. Maddie Jackson. So you'll see a lot of testimonials or people's feedback, so you get to see if this is good for you. Now here we also make sure we get you intervention skills and adapting to your style. Right? When you're sitting across of a client, you need tools. So here there's many interventions that you could replicate. Parts mapping, I have a really creative way to teach you parts mapping. There's a creative exercise and meditation, grounding exercises, boundary setting. I have somatic boundaries, exercise settings, distancing techniques when clients are overwhelmed, resources, working with the inner child, and also how to work with people who have compassion or they might have phobic avoidance of their inner experience. They don't want to go inside. They don't want to be compassionate. They don't know how to be. Somatic processing. So there's somatic sequencing and somatic processing. There's attachment interventions, window of tolerance, body scan, and there's a lot more. Here's me, and I'm smiling because I'm happy you're here. Super passionate about helping clinicians harness their trauma-informed skills. I want you to not only help clients heal, but for you to have a deep knowing that your skills are adequate to help the client sitting across of you, right? I've acquired a thorough, robust skill set that's helped me help clients, and I'm so excited to help you. Here's the application. Here's how you apply. So for the 6-month training where you get live consultation and access to the trauma resource library, the 6-month training, the cost is $5,500. If you pay in one-time fee, you get a $300 discount. So it's $5,200. If you'd like to pay it off over 6 months, that's $916 a month. And if you want to do an extended payment plan, you could do $611 for 9 months. I want you to be able to pay for this. I will tell you, in terms of investment, I've invested hundreds of thousands of dollars in my trainings in terms of, EMDR training, somatic training, or even not even trainings in consultation. And the reason I've created this as a training and consultation is because I've done trainings, but some of the trainings I didn't get individual consultation. And I needed to know how to apply it to me and to my clients. And then I spent even more time, money, and energy traveling, reaching out to therapists and experts. And so what I've done here is I'm here to not just teach you, but also help you apply it, help you own it, right? So you're getting like a very robust and personalized experience. It's an immersive experience. It's not just a training, right? And I'm at a place in my career where I only want to work with people who I know are going to get the most out of it. So you're only going to join if I know it's really going to help change you, the way you work, and the way you show up to your relationship to work and to your life. Here's the application. So let me just show you how you apply. There's a lot of FAQs. I answer almost all the questions. If you have more questions, you can always reach out. And here are endorsements from my fellow colleagues who are also trauma experts. So Annie Wright also has a course. She runs a group practice with 18 clinicians. Ricky Jacobson, also, she's the founder of the Center for Relational Resilience. Laura Hahn is also the founder of Mindful Living Counseling. Leah Subar. Yolanda Harper owns Harper Therapy, and she wrote a book called Soul Sabbatical. And really, like, they know me very well as a person, as a professional, right? She says, effective trauma treatment is a combination of science and wisdom and art, wisdom and practice. That's where Esther comes in, right? Because it says you can have a lot of skills, but when you're sitting in front of a client, you have to know the right skills to use, okay? Here's a Tara Weinstein, another colleague of mine, Stacey Steinmiller, Devorah Goldman, Erica Wilcox is the EMDR expert. So you get to like see my colleagues who know me, who I've called to support me, to challenge me, to make sure that I'm really growing as a person and as a professional. Because just like I'm creating a space here and I have at my group practice, to have community, I have my own community and investments and people who hold me accountable and help me grow. And then here are some other testimonials from the recent cohort attendees, because we've had over 140 people be in the cohort. Here's Eleanor Brown. She's trained in brain spotting and EMDR. I joined the course after hearing a colleague's testimony. It's been one of the best professional decisions I've made. What stands out is Esther's depth of knowledge and how she embodies lifelong learning. She doesn't just teach, but she inspires us to keep growing. I do. I'm excited. I want you to all grow and find your passion. Tamra as well. She talks about gaining skills. What is surprising, how much I've actually learned about myself, because really this is an experience for you to transform yourself. Ryan talks about how he loves the groups. Our live sessions have been amazing to consolidate our learning and discuss with Esther and our peers. Debate and discussion with top professionals has always been a great resource of learning. Melanie, right? She's trained in EMDR and Somatic. So here are some more advanced clinicians, and then there's also some newer ones, right? Like Michaela, right, Elisa, Dr. Sarah are involved. So Michaela was newer in the field, right? But she wanted to make sure that she's going to have a good trauma toolkit. Since I'm early in my career, earlier, I wanted a strong foundation in the trauma approach. Esther's so friendly and kind. She cares about us. The curriculum has a lot of material. As someone who is newer, I was nervous about being able to understand the material, but Esther makes sure the material is accessible for people of all backgrounds. So I really do my best to make sure that obviously if you're in the training, you're going to be able to gain as much as you can. Okay, and I want you to be able to digest it and own it. Now, let me just show you briefly the back end of the program. Now, before I do want to show you a booklet that you get. I like giving away. I mean, maybe at one point I'll publish this and it won't be for free, but you get it right now for joining the trauma cohort. I created with someone who is an artist, an IFS booklet, a parts booklet. And I teach you all about parts work as part of good trauma therapy, like understanding the concept of parts. Because I think really good trauma therapy is a mix of somatic, parts, attachment. And so here I explain parts work, and you could obviously use this once you join the cohort. You can print this out for yourself and your clients. Obviously, don't sell it. We have a whole legal form actually when you sign up that you can use my content, but you can't sell it or steal it because then legally it protects my intellectual property. But here's information. I'm happy for you to use this language. And you learn all about parts, right? You know that you're leading in parts. And then I explain to you the concept of an exile, which is the inner parts of self, right? Emotional parts, parts that hold wounding. Then there's manager parts, right? Parts that manage and protect. And then there are firefighter parts, parts that numb, parts that try to survive. And then I obviously teach you, I go into depth, like here's the Hulk trying to protect a little child state. And then there is an exercise of getting to know your parts. So that's just briefly one of the extra resources that you get from the course. And now I'm just going to show you a sneak peek into the back end of the course format, so you get to see like what it actually looks like once you join and sign up. Okay, so let's show you this one. Okay, so curriculum. Okay, what you're going to see when you join and you submit your payment and you're in, what you get, this, we have either the January schedule or the June schedule, right? So whenever you start, or if you sign up, obviously before you start, you'll get access to the welcome packet. The welcome packet, there's an introduction section and then there's many modules. The welcome packet basically just tells you what it's going to look like when you join, okay? So you get a copy of all the modules, all the information that we're going to review, right? Here's the welcome packet. Okay, here's a little bit about me. Here's a sneak peek into some of the images, And then each module, and it goes through what we're going to have as the course outline, right? Like what each module is going to cover. What is a trauma therapist? Making of a therapist, the paradigm shift, contemporary trauma research, the history. And then here we go into Jack Pink stuff in the neurobiology, attachment, supporting insecure attachment, betrayal, the overview of shame, like I said, healthy shame and toxic shame, the impact of childhood experiences, self-concepts and beliefs are born, right? The impact of trauma on the body. Now, this is more extended than the 6 modules because we extended it so it's easier to digest. Trauma and dissociation, structural dissociation, countertransference, grief, right? And then here's the whole segment on assessment, screening and assessment tools, the importance of body language, choosing the right interventions. Now, what you get is there's a video, like I said, to make it like easy to digest for each segment. So there's, welcome to the trauma community. Here I am welcoming you. Who am I? Talk about who I am, right? A little bit so you get oriented to me, but you're also going to meet me live. Expectations of the course. I want to set you up to be able to be happy. Like, what are your expectations from me? And what are my expectations, right? Like, we want to set you up for success. So it's like, what are my expectations? What are your expectations of me? And what are your expectations for yourself and for your clients, right? You want to make sure that you get the most that you can. I'm just pulling up the other one because that was the wrong course. That was a drafted one. Okay. The reason I make so many copies is each cohort, we have live recorded videos. And so in the recorded videos, we talk about strengths, struggles, needs, clinical concepts. And so you'll only get to see videos of people in your cohort just to protect privacy and to keep the group conversations just to each group. Okay, so here's about Esther Goldstein. Here's our reciprocal commitment, my commitment to you, your commitment to your clients, right? How to maximize your course experience, establishing boundaries in and out of the office. So really, we're coming up with a good foundation so you can actually embody and do this work long-term. Then what you have is case consultation form. I review the case consultation. If there's clinical clients or a concept that you want us to dive deep into, I review this. Okay, you put in the information about your client. Here's the glossary. Here's the Zoom info and dates. You'll see the There's a copy of the calendar for whatever dates we are going to be meeting live. So you'll get a link to that once you join. And then the other thing that you'll see is your goals, right? So your goals, what we do is I want to make sure that you are just like you do this with your clients, right? What are their goals? What are their expectations? So in the beginning, I ask you to fill out a form about your goals. What are your goals? How do you know that you're getting what you wanted? How would you like to feel in 6 months' time? And then we track it to make sure that we're hitting your goals. And then here's your agreement, right? That you're signing here that you're not going to replicate it. My commitment to you and the limits of engaging in this course. And then this is, by the way, also same for you. Like, what's your services agreement you have with your clients, right? I want you to be clear that your agreement is clear, your clients' boundaries, communication. And then we go into who you are as a trauma therapist, right? Who you are as a trauma therapist, trauma defined, the spectrum of trauma therapy, right? And there's a lot of research and documents here, right? So this is really like, what does it mean to be trauma informed? And as you get clearer on all of this, like, you hold yourself clearer, even if you don't say much more or different in sessions, right? Now, I do want to show you, if you want to get the CU1 certificate, you do have to fill out these questions. So you get at least an 80 from all the quizzes, which is pretty easy to get. And also make sure for me that I know that you're understanding the information. And then at the end of every live call, we have a copy of the Zoom video. So if somebody spoke about a concept that you want to hear, it's going to be here. So you'll be able to rewatch it and listen. And then for the case consults, what you'll see is I will give feedback on the case consultation before we talk about it live. So I'm reviewing it. You could learn from each other, from the case consults, and get input. Then we go through the history and science of trauma. For those of you who are skeptics or your clients who are skeptics, there's a research here that I have on, different types of trauma, the history on trauma, psychotraumatology, right? It used to be called shell shock, war neurosis. You see like the history, the timeline, what the terms were, the diagnoses, modern trauma, the primary kinds of trauma, why trauma stresses you out. We talk about trauma in the body. There's a lot of body language videos. Then there's emotional neglect, betrayal trauma, the relational dynamics. So there's a lot of videos here. The relational prism, right? We talk about attachment, the role of memories, how memories inform trauma, explicit, implicit, right? Then procedural behavior, right? Procedural learning, how we have like the ways that we unconsciously learn to behave. This guy learned to ride a bicycle, and then he wanted to learn how to ride it with the handlebars backwards, and it took him 8 months. He literally watched the video, and he wanted to see if we could change our behavior, especially for people who feel doubtful. And then he took his 4-year-old and he taught him how to ride a bike for the first time with the handlebars backwards, and his son picked it up right away. So we talk about how do we change procedural behavior. That's part of good therapy, is we're working with shifting neural networks, the concept of memory reconsolidation. Here, I teach you all about emergency responses. Are your clients stuck in flight, fight, flight, freeze, submit, attach, right? The role of memory, attraction and repulsion, why some people keep being attracted to unhealthy relationships. And instead of just getting stuck in the why, how can you use an attachment-oriented therapy or work with inner child or work with their beliefs that unconsciously keep reenacting a drawn and attraction to what they're attracted to. Okay, and then here I teach you a lot of somatic interventions, not a lot, but I teach you there's 2 different kinds of ways of working somatically. There's fight or flight, and there's rest and digest, right? But here I'm teaching you the difference between reinstate and act of defense. Somebody was stuck in either not being able to fight, teach you somatic techniques, or if somebody's stuck in a flight response, right? You'll see if somebody's chronically stuck in panic attacks. And then I literally will teach you the difference between somatic sequencing, which is allowing the body to sequence through, moving through emotions, sensations, energy. And then there's engaging in other kinds of somatic interventions. Here I teach you all about learning how to read the language of the body language with your clients, what the body posture reveals, right? All about Ron Kurtz's work. And for you, even if your client doesn't say anything, to learn how to read your client's body language, right? The body postures. If they're stuck in a needy stance, if they're stuck in a burdened stance, right? And I literally have like images where I show you how to help your clients for you to better understand what needs to be part of their treatment. How to incorporate somatic informed techniques, right? Here I teach you all of this. Assessing the body, Pat Ogden. Here's like looking at the forces where the body might be holding certain forces. You'll see here the body is more relaxed. Here there's a collapsed chest, a pulling in, a head tilting up, a child that's like looking up almost at a parent, usually being yelled at. Here's someone who needs to prove, right? So here, like I teach you how to work with these body postures and the beliefs and how to incorporate that into your therapy. How trauma treatment can help. We talk about how does it actually help, right? What's the difference between trauma treatment and regular therapy or trauma-informed? Memory reconsolidation, right? How do we actually change the way that the brain works? And it's not that we're getting rid of memories, it's that we're shifting the flavor, the emotional valence of the memory in the brain, right? So I think a lot of us knowing how do you explain the concept of memory reconsolidation to your client? Why should they be engaged in therapy? What could they be expecting to engage in? Here are different kind of therapy types. Here are boundaries. I teach you somatic boundary exercise. You can use this in session. I literally walk you through how to do it, and then we might practice it together, right? And then the client lets me know, stop, if they hand up. Okay, and then I teach you about attachment, right? Attachment and the neurobiology of attachment healing. Jack Panksepp, here's Sandra Paulson's work. She talks about helping clients move through the developmental milestones that got skipped over. There's Jack Panksepp's and the neurobiology, right? Our clients who get stuck in, not being able to engage or experience. Here's a lot of his research and my information. The 3 parts of the brain. And I teach you how to actually draw this out with your clients, the primary core emotions and affective circuits. When these don't get expressed well, then they'll struggle with shame or blame. Versus when you can meet it, empathy, trust, and pride. And then there's the capacity for mentalization. But there's also ways to work with the affective circuits. The birth of self-concepts, right? This I love, the 5 developmental actions by Bonnie Bainbridge Cohen. She's an occupational therapist, and there's incredible somatic therapy exercises I teach you for clients who are stuck in either a yield, push, reach, grasp, or pull. Like often clients are stuck either like in chronic fight or flight and they're never able to yield, or they're constantly pushing people away, or they never learned how to push and separate, right? It's basically connected to a baby in utero and milestones or physiological neurocellular movements that they did or didn't engage in. The concept of developmental movements and how we know that we're safe and how we know that we can engage in certain patterns. And I literally teach you the concept and also, and so you'll see this with your clients and also like actual activities and skills. I'm going to list you with a stuffed animal. I'm going to show here. I show you with the stuffed animal how to do it and how you can do it with your session with your client. So I'm coming towards them, I'm facing them, right? They're standing, and I'm standing, or they're okay. And then I show you how to do the push. I show you how to do a reach when your client does like a reach, like reaching up to you. And obviously you want to set it up properly in a way that is helpful for the client, that you're connecting to the right child state or emotional state. Here I have somatic intervention with relationships. And you might say, let me take on your girlfriend, Deborah. Okay, and let's feel out how this feels. right? And there might be a grasp-y dynamic, an avoidant dynamic. So I would just use this. You could. So I show you how to use either ropes or animals or objects. Here is grief, depression, denial, dissociation. So I love this segment on dissociation. I have an entire module on this. I consulted with dissociation experts because I never really learned a lot of the advanced concepts that I had to learn after when my clients came in with dissociation. And when you treat trauma, you got to know dissociation. Basics on dissociation, non-pathologizing dissociation. Here's a lot of my research on dissociation, ask, right? And then with dissociation, you want to first help them develop grounding skills, but you also want to get to the core pain point that's causing the client to dissociate, right? That's part of good trauma treatment, that you want to help the diagnostic criteria go down. And so here I teach you some skills for how do you work with dissociation, right? What does dissociation mean? Your client's dissociative reactions, and I teach you how to help lessen the amnestic barrier, the basics of dissociation, how you work with dissociative parts, right? What dissociation looks and feels like inside and outside of session. Okay, there's like exercises I have here. Oh, teach you how to work with a client who's dissociative, looking in the mirror, or being able to orient to the here and now in real time. Okay. Distancing techniques, resiliency skills. So there's a lot here that I'll teach you. Pitfalls and plans for successful outcomes. Yeah, we want to plan for times that we're going to be successful or we're going to make mistakes, right? Then there's an entire module on shame, healthy shame, toxic shame, somatically how we work with shame, and then we talk about the therapeutic dynamic, right? The dynamic between you and your client, improving clinical outcomes, purpose of shame, the dynamics, the window of tolerance, pacing for progress, what's behind the trigger, and all of that. Okay, so this is essentially, and then there's a lot of extra tools that I teach you. Oh, here's the whole concept on assessments and reassessments, screening and assessment tools. Literally here, you have so many assessment tools. Here's all the assessment tools. Yeah, there's so many PDF documents. So basically, I'm just giving you an entire resource library that took me like over a decade to create. And you basically have access to all of that. See, all of these trauma checklists, genogram worksheet, attachment, interviews, OCD. See, it's just, yeah. And yeah, then here's parts mapping. I teach you how to do a parts mapping exercise. And that is basically it. Let me show you where you apply for this training. So you'll have a link likely that you'll have gotten, but in case you're looking for it, you go to my Google Esther Goldstein trauma training, or go to my website, which is traumatherapist.co, press on trauma training course. And on this trauma training course, what you'll see is you press on apply for the next cohort right here. And what you do is you get information to the page, the application page. And we want to make sure it's a good fit for you and a good fit for us, right? And that the group is really supportive for each other. So the way that it works is that number one, you fill out the form below. It's an application. Number two, you'll be taken to my calendar to book a free 15-minute call because I really want to make sure this is right for you and you're the right fit for us. I'm really investing in you. I want to get to know you as a person, as a professional, your goals for now, where you want to go. Third step, we'll meet, we'll go over your goals, and we'll review the syllabus. I'll show you more of the back end if you have